Renuva is an excellent treatment. Once injected, it gets replaced by your own fat cells over about a 3-month period or so. It creates sort of a honeycomb effect with growth factors, and that the Renuva essentially dissolves over a period of time, and the fat cells that remain are essentially permanent, meaning as permanent as any other fat cell in your body. Fat cells in general, as adults, don't replicate, meaning they don't divide and grow, you don't get more of them, except for if you use Renuva. We also know that fat cells in the human body last about 10 years, they get replaced by an identical fat cell. We don't know if that happens with Renuva yet, since it hasn't been around that long, but we suspect that these fat cells last as long as your fat cells do, so that it should be many, many years of volume retention. So in the case of your cheeks, you will have volume there for many years. Now, of course, we continue to age and our faces continue to age, so even if you have fat cells there, everything else starts to age and drop, so you may feel like you need more volume at some point to correct the new changes that aging brings. We also do have some volume loss with aging in general. So do we lose that volume that Renuva adds? We don't know the answer to that yet. Presumably we may lose some with aging simply because they are natural fat cells, but we don't know that, and we do know, however, that the results are very nice and they do last for a long time.